The West African sub-region is experiencing the worst Ebola outbreak in history, and President Goodluck Jonathan has declared a national emergency on the control and containment of the Ebola virus in Nigeria. I'm Linda Akibe, and you're welcome to the Gavel. Now, 2 deaths have been recorded so far in Nigeria as a result of the Ebola virus. During the week, the House of Representatives Committee on Health held an emergency meeting with the Minister of Health and other government health officials to find a solution to the problem.
On Wednesday, the 6th of August, the Minister of Health, Professor Onyebuchi Chukwu, confirmed the death of a Nigerian nurse, one of the caregivers of the Liberian victim, Patrick Sawyer. And on the same day, he declared the Ebola outbreak in the country a national emergency. Following an initial briefing of the press Wednesday morning and the Federal Executive Council, the minister, in the company of key players on health and disease control, also came before the Health Committee of the House of Representatives to give lawmakers updates on the situation of Ebola in the country. The House of Representatives Committee on Health called an emergency meeting with the health officials to find out how many Nigerians are affected by the Ebola disease and what is being done to halt a possible spread of the virus.
Nigerians are getting worried every day on the devastating effect and life-threatening magnitude of this virus. And of course, as true representatives of the people, we cannot sit down even though we're on vacation and fold our arms as if nothing is happening. Hence, the leadership of the House directed that the committee reconvene for the purpose of this meeting that we're here today. The essence of today's meeting is to get answers to the following questions. 1, how did Ebola virus enter Nigeria? How many Nigerians, in truth, are affected with this Ebola virus as at date? Thirdly, what is the Federal Ministry of Health and in particular Center for Disease Control doing at the moment to curtail the spread of the virus?
Part of the details given by the minister was that Mr. Patrick Sawyer, the man credited with bringing Ebola virus into Nigeria, knew he was sick with the virus before entry to Nigeria.
Now we know from our interactions with even the Liberian government that before he left Liberia, this man knew that he was sick. The government was aware he's sick. Government said you should not even travel. But again, that tells you again why the disease is so difficult to control. He traveled. And by the time they had a stopover in Lome and eventually landed in Lagos. By the time he got to Lagos, he was so weak that he had even collapsed. And people nobody took any care. Even airport staff, everybody went to assist to bring him because nobody knew what it was at that time. Nigeria has confirmed a total number of 7 people with Ebola virus disease, which includes the index case, the American Liberian. So if you remove that 7, if you remove the Liberian, it means that 6 Nigerians have been diagnosed with Ebola virus disease. Now, even among the 6 Nigerians, we have lost 1 yesterday. So we have 5 people that we are sure has Ebola virus disease as at now, who are receiving treatment in Lagos. But there are those who have sent their sample to LUT for results. That's why I said it keeps changing. So we're waiting for results. We're going to get, by the end of today, we'll get additional results. So people should not be surprised if that result changes anything.
Also briefing the lawmakers at the emergency meeting, the project director at the Nigeria Center for Disease Control, Professor Abdul Salami Nasidi, disclosed that 70 Nigerians are currently under surveillance for the disease, being people who were confirmed to have come in contact with the initial Ebola victim, Patrick Sawyer.
As of today, we have 70 registered contacts that came direct, with the patient on his way. Out of this, we have 39 hospital contacts, 9 laboratory staff, 22 airport contacts, and all these contacts are being followed up closely. I would like to mention that the job we're doing might actually save Nigeria, because if we can, as the Honorable Minister has mentioned, track all these 70 and get them at the early stage of the disease, our case fatality rate might be less. And why do we want this to happen? If we don't do this and we have many dead bodies, the experience we have from the other West African countries shows that almost 70 to 80% of other transmissions are occurring during burials.
Dousing any possible spread of anxiety on the matter, the Director of Port Health Services in the Health Ministry, Dr. Sani Gwazo, said restrictions have been placed on the repatriation of corpses of Nigerians abroad into the country during this period of Ebola scare. He said additional personnel is required to screen travelers at the country's entry points.
The total number of staff under the Port Health Service today is 561, comprising doctors, nurses, environmental health officers, health assistants, and a few clerks. But we have a problem here. The number of approved registered professionals to non-professionals is 1 to 3.
Some of the issues disputed by the health team was the purported curative powers of bitter kola on Ebola, a claim reportedly propagated by Professor Maurice Iwu. The health minister said that no evidence shows that bitter kola will prevent or cure Ebola, adding that Professor Iwu's experiment is inconclusive.